We're going to go through the painted bone structures of the scapula. So starting on the anterior side, we have the origin of the subscapularis here. We also have the origin of the long head of the triceps brachii on the infraglenoid tubercle. On the supraglenoid tubercle, we have the origin of the long head of the biceps brachii. Up on the coracoid process, on the very end, we have the origin of the coracobrachialis. Right next to that is the origin of the biceps brachii short head. And flipping to the posterior side of the scapula, we have the origin of the supraspinatus here in the supraspinous fossa. We have the origin of the posterior head of the delt. We have the origin of the infraspinatus, and then we have the origin of the teres major here and of the teres minor here. Moving on to insertions on the scapula, we are going to go back to the anterior side. So looking at the lateral aspect of the scapula, we have the serratus anterior insertion, and up here on that coracoid process, we also have the insertion of the pec minor here. Going to the posterior side again, we have the insertion of the rhomboid major, the insertion of the rhomboid minor, and then the insertion of the levator scapulae. And on the spine, we have the insertion of the trapezium. More distally to the humerus bone, we're going to do the origins and insertions here. So first with orientation, we want that head to be facing in. So this is going to be a righty. We are going to have the rotator cuff muscles on the head. So on that lesser tubercle, we are going to have the subscapularis insertion. Then moving over to that greater tubercle, we have the supraspinatus insertion, infraspinatus insertion, and then the teres minor insertion. Keeping it in the anterior position, moving down to that major sandwich, we have the pec major here, the latissimus dorsi, and then the teres major here. Just below that, on the deltoid tuberosity, where our deltoids are going to insert, and then on the medial aspect of the humerus is where our coracobrachialis is going to insert. Moving on to our origins, we are going to have the brachialis, and then on the radial side or the lateral aspect of the humerus, we are going to have the brachioradialis here, and then we have the extensor carpi radialis longus just below that. On the lateral epicondyle of the humerus, we have the common extensor origin, and then just distal to that is going to be our anconeus origin. On the medial epicondyle, we have the common flexor origin, and then just proximal to that is going to be one of the pronator teres origins. On the posterior side of the humerus, we have our medial head of the triceps brachii, and then just above that radial groove, we are going to have the lateral head of the triceps brachii. Okay, moving on to the radius, origin and insertions here. So for orientation, we want that styloid process to be on the lateral side, and then we know that this sharp edge is going to be on the medial side for the interosseous membrane with the ulna. So anteriorly, we're going to start off with our insertions. So first off, we have the biceps brachii insertion on the radial tuberosity, and then on kind of the lateral, more posterior side here, we have the supinator insertion and the pronator teres insertion here. Moving more distally, we have the pronator quadratus insertion, and then right here on that lateral aspect as well, we have the brachioradialis insertion. Moving on to our origins on the radius. So here in front, we have our flexor pollicis longus, and then on the medial side we have our abductor pollicis longus and our extensor pollicis brevis. And going on to our ligaments down at the bottom, so here on the medial aspect we have the articular disc insertion, and then we are going to look at the grooves for the ligaments. So for our lateral side, we have the abductor pollicis longus and the extensor pollicis brevis ligament coming through here. Moving more medially, because I'm posterior, we have the extensor carpi radialis longus. Moving in, we have the extensor carpi radialis brevis. Here we have the extensor pollicis longus. And here, number 10, we have the extensor digitorum and the extensor indicus. And on this, also on that styloid process, is going to be the radial collateral ligament. All right, we have the ulna. We're gonna do our origins and insertions of the muscles here. So first off, this bone is missing that styloid process, but we want that to be facing medially. And then on the lateral aspect of the ulna, we have that sharp edge of the bone for that interosseous membrane to go there. So we're here on the left arm. So first off, starting off with our insertions in blue, we are gonna go for the brachialis here, and then on the posterior side, on that olecranon process, we have all of the heads of the triceps brachii inserting there, and then we have the anconeus inserting just below. Moving on to the origins on the ulna, we have right here, the flexor digitorum superficialis. Just below that, we have the other origin of the pronator teres. We have the flexor digitorum profundus, and then the origin for the pronator quadratus. And over here on the side, we have the origin of the supinator, and then on that lateral posterior side, we have the abductor pollicis longus, we have the extensor pollicis longus, and then we have the extensor indicus just distal to that.